Hi, I'm Dr. David Lang with Lang Chiropractic Center, and we're putting together these video series to demonstrate what we do for rehabilitating the lower back, the middle back, and the neck, and also going through some stuff called corrective care, which is going to help mainly our patients with scoliosis and those looking to restore the curve in the neck. But first, we're going to get started with low back exercises. So what we're going to do, Lindsay's going to be here, we're going to demonstrate each one of them, and we'll go step by step showing you guys how to do them effectively so that when you start your care plan here, you'll be able to do these at home without any problems. Okay, the first exercise we're going to go over is something called a pelvic tilt. Now this is extremely important in mobilizing the lumbar spine and the pelvis. This is one of the first exercises that we prescribe for patients when they have acute lower back pain and are in a lot of discomfort, or there's just a lack of mobility in the pelvis and the lumbar, which is the low back. So Lindsay, if you'll go ahead and get in position, we'll demonstrate how to do a pelvic tilt. So you'll have the patient on the back. You want their knees just a little extended here, okay? You want your hands by the side, right? So you're not pushing down or anything with your hands, they're just there relaxing. So the point of a pelvic tilt is to get extension and flexion into the low back and in the pelvis. So we're going to start first with getting extension, okay? So Lindsay, if you will go ahead and demonstrate the first move here. So we're going to extend the pelvis back, basically lifting the stomach up, creating space underneath the lower back. But you notice her bottom side is not leaving the table and her shoulders aren't leaving the table. So her back is still, we're just getting extension into the low back here. So tilt forward here, there we go. And now we'll tilt all the way back. Now the second part of this move, she's tilting back. So she is flattening out the low back against the table. And this is really important for flexion. So this is typically the range of motion that gets lost when the back is in spasm. So this is really great for acute lower back pain. So you've pulled your back, or even if you have a herniated or a bulging disc in the back, the pelvic tilt is what we go over first. So let's do a few more here, Lindsay. So extension and then flexion. And all that's happening is the pelvis is tilting forward, the pelvis is tilting back. Forward and then back. Okay? And you want to do this exercise depending on how much pain you're in and what you're able to tolerate. Most people will start out trying to do 6 to 8 of them in a row, okay? Nice and steady, you don't want to go too fast. You want to make sure that when you're doing these, you're activating your core muscles, so your abdominals, your lower back, and you shouldn't be using any leg muscles to do this. This all comes from your core, okay? A strong core will help prevent injuries, and so it's a really important exercise in the beginning here. Okay, let's do a couple of more. So let's start. Your extension all the way back into flexion, extend it out, and all the way back. Okay? If you notice your bottom coming off the table when you do these, you're not doing them correctly. So your bottom and your shoulders need to be making contact with the table at all times. So the only thing moving is the midsection in the core. It comes up, and then it goes back down and flattens out. So it comes up, and then it flattens back down. Nice and steady and smooth. And this is a pelvic tilt. Okay, now we're going to do the next move. It's called a bridge. Now this is the second move that we do in the series. Once you've mastered the pelvic tilt, you're able to do that effectively. Okay? So Lindsay, let's go ahead and lie on your back and we'll demonstrate the bridge here. So when we demonstrate the bridge, we want to start by doing a bridge with a pelvic tilt. So a bridge is where we bridge the pelvis and the lower back off the table, creating a straight line from the knee to the shoulder. Okay, and we'll show you what that looks like. So let's start by flattening the back out in the tilt, and now we're going to lift your body up. Here we go. Now I want you to hold that for just a second, Lindsay. What we want to look for in a bridge is that we have a nice straight line from their knee all the way down to her shoulder. As well, her hands are still flat against the table. And one really important component of this, her hamstrings should not be tight. So you should be able to move and wiggle the hamstrings on the lower and the upper leg here, the back of the thigh. If you're using your hamstrings to do most of this movement, then you're not activating your core muscles and they're not the ones that are rehabilitating here. So, okay, let's go back down, Lindsay. And when you go down, tilt the other way. There we go. So with every bridge, you'll include a pelvic tilt, which is essential to really master the pelvic tilt before you do a bridge. Okay, let's do it again. So tilt back, and then we'll bridge up. Here we go, perfect. Hamstrings are nice and loose here. You can feel the lower back muscles are tight. The glutes and the lower back are doing most of the contracting through here. A nice hollow core, tight abdominals, and we have a nice straight line, not having any angle or bend in the pelvis. And same with the pelvic tilt, you want to start by doing 6 to 8 of these, working your way up gradually to 10, and then doing multiple sets of those, gradually progressing as you increase and get better at the move. Okay, now the next move we're going to do here involves both the pelvic tilt, the bridge, and it also is going to involve, it's just an addition to the bridge. So it's a bridge with a lower leg extension. And this is going to force your body to stabilize more left and right and use a lot more core to hold, okay? So this will involve a lot more strengthening of the lower back as you try to stabilize the move during the whole process. So Lindsay, let's go ahead and go on your back and we'll do the bridge with the leg extension. So again, same position as our tilt and the bridge. On your back, knees bent slightly, feet about shoulder width apart. And let's go ahead and tilt back and bridge up. Now we've learned these two so far, so the next component of this is to then extend your lower leg. So notice she does that without changing the height. So this leg here and this leg here should remain parallel the whole time. Now let's take that leg back down, and they never change in their height. Let's do the other leg. Okay. This forces the pelvis to remain stable. If you notice that when she does this, if you notice the patient dropping in a hip this way, or let's do it the other leg here. If you notice if you do these and you notice that your pelvis is dropping down, then you're losing stability. So you really need to work on these to build some strength in the core to stabilize the body. You want nothing changing in the plane of movement here. You want to remain as flat and stable as possible, as the only thing that changes is the lower leg lifting off the table. Okay, let's do it one more time, Lindsay. We'll come up. Here we go. And you hold it for a few seconds and then you're back down. Let's do the other leg. Bridge up, extend out, hold. Remember, don't let any of this move, so no tilting, no dropping or sinking, okay? And come down. Now, a few things about this. If any of these exercises are causing pain, rehab of the lower back should not be painful. So when we're going through these, if you begin to feel a lot of pain or too much discomfort that prevents you from going forward, you need to stop and rest, okay? And then ask your provider about it, or come in and ask us about it. So you really want to do these in a pain-free range, okay? So if any components that we mentioned earlier, the pelvis starts tilting or dropping, if she starts using more of her hamstring to do the lifting, or she's fatiguing, or you notice the patient shaking in the lower part of the leg or the core, then that just means this is going to be a really crucial exercise to really work on to build some of that strength. Strength in this region prevents injury, so it's important to do it correctly. All right, and that is the bridge with leg extension. Okay, now this next move we're going to do is called a knee to chest stretch, okay? And this is not a strengthening maneuver here. This is really more of a stretch and a mobility component. It's going to help give a little more range of motion to the hips and the lumbar spine, which is your lower back, okay? So patients who are in a lot of pain can do this even at the very beginning before the other moves we've demonstrated. So a knee to chest stretch, you can fold this particular move in at any point during your rehab, okay? So we'll go ahead and demonstrate a knee to chest stretch here. Again, it's a very similar position that we've described previously on the patients on the back, hands by the side, okay? Knees, feet about shoulder width apart, and there's a slight angle in the knees here. And what we're gonna do is we're gonna instruct the patient to grab one knee and pull that knee to the same side with same shoulder, okay? So you'll pull that knee towards the same side shoulder and then pull gently until you feel a stretch, and then you hold it for a few seconds. And then you'll put the knee down, nice and steady, and then you'll repeat the same process with the other leg. Pull and gradually pull up. And if you want more of a stretch, while you're pulling the leg, you can let the other leg go flat and that will give more of a stretch to your hip flexors during the same maneuver, okay? Now, the second part of this move is where we pull the knee towards the opposite shoulder, and this is going to bring a different stretch feel to it. It's going to start activating more and stretching more of the piriformis muscle and your glute medius, which are very important hip stabilizers. And they're really important when you're treating piriformis syndrome, sciatic pain as well, okay? So let's bring the knee and you'll pull it towards the opposite shoulder. Gradually pull, and again, if you want more stretch or if the other leg gets in the way, you can lower that, lower the non-stretching leg, and that will help to stretch out your hip flexors just a little bit. And Lindsay will do the other leg now. Pull that knee to the opposite shoulder. And again, stretch this leg all the way out to get a little more stretch on the hip flexor, okay? Now, once you've done this repetitively, 6 to 8 times, working your way to about 10 stretches per leg, you'll then want to bring both knees up to the chest. And this is going to be very effective in treating facet syndrome and mild strains of the lower back when a patient has what we call an extension strain, which are your typical strains that happen when you're working around in the yard or you've just lifted something wrongly and you pull the back and it gets really tight. This is a great stretch for that, okay? So let's bring both knees to the chest, okay? And stretch nice and pull it up. And as she's stretching and pulling, what this is doing is it's flexing the lower spine. And it opens those joints and opens the disc spaces, allows for the joints to have less pressure on them, and it stretches the musculature that's usually overactivated or hypertonic because of the strain or pull, okay? There we go, good job. And that is the knee to chest stretch. Okay, the next move we're going to do is something called a cat camel, or you may know it as a cat cow in yoga. It's a particular stretch that just really involves a lot of mobilization of the spine, allowing the spine to flex and extend without your body being in a weight-bearing position. So you'll be on all fours, allowing the knee, the lower back and the mid back, and even in the neck to stretch, flex, and extend there, okay? So Lindsay, if you'll go ahead and go on your hands and knees, we'll demonstrate a proper cat camel, okay? So in the cat camel position, you want the patient's knees about shoulder width apart, okay? You want the knee right underneath the hip, okay? So you don't want to be sitting back on the knees here, and you don't want to be going all the way forwards. You want it just about a perpendicular 90-degree angle here, the knee directly under the hip. Same with the shoulder. You want the shoulder, the wrist right underneath the shoulders, and you don't want any bend in the elbows here. You want a nice straight elbow. So this puts your back in a nice rectangular position, okay? Now a cat camel, what we'll do with the cat camel is start off with extension. So you'll start by trying to put your belly to the table, and as you do that, you'll lift your head up, and that gives extension to the neck, and extension to the low back, and extension to the mid back. So this is the extension portion of the maneuver here. And now we'll go into flexion, the exact opposite. So as you do this, tilt the head down, tuck your chin to your chest, and you'll bring the lower back up, okay? This puts flexion in the spine. Okay, and all the way down. Try to go all the way down. And remember, when you're doing this, keep a nice tight elbow. Don't let these elbows bend, okay? This is not a push-up. The only thing moving here in this particular exercise is her spine. Her knees aren't moving, her hips aren't moving, her elbows and shoulders aren't moving. We're just flexing and extending the spine here. Let's do 1 or 2 more here, Lindsay. All the way up. Try to arch as much as you can through here, okay? A nice arch here will ensure a lot of flexion in the mid-back. And extend all the way. Very good. All the way extended. Okay, very good. Thank you, Lindsay. So that's a cat camel. The cat camels are very good for patients who are in acute pain. So if you've strained your back at home and you're waiting to get an appointment somewhere, you can do the cat camels right in your home. Right on the floor or the bed, whichever is easiest for you to get to and get back up from safely. You'll want to do a set of 6 to 8, working your way to 10, even 12 to 15 repetitions, and do those in multiple sets. So the cat camel is great for acute pain. It's also a great mobilizer, and it's a great exercise to begin a series of moves with because it provides movement and it warms up the joints. Okay, the next maneuver we're going to do, or exercise we'll do, this will be more of a strengthening and stabilizing move. This is called a bird dog. So once you've mastered your pelvic tilt, your cat-camel, your bridges with lower leg extensions, and those other moves that we've described, you'll really want to start working your way and progress to doing a proper bird dog. And this is going to force you to stabilize the spine a little bit, okay? So Lindsay, if we'll go ahead and go into our all-fours position here. Okay, so starting position for the bird dog is the very same exact way as it is with a cat-camel, okay? Your knees are directly underneath your hips. Your wrists and hands are directly underneath your shoulders, so you're in a nice box, okay? So the purpose of this is to mimic the way that we walk, which is a cross crawl method. When we step with our right leg, we typically swing our left arm, okay? This is the natural gait pattern. So we're gonna mimic this and strengthen within this functional range of motion, okay? All right, so Lindsay, let's start with your left arm and your right leg, okay? And as notice her head position. So as she goes to lift this leg and lift that arm, she also lifts her head up looking straight ahead, okay? And back down. Now imagine that you have a glass of water sitting here and you don't want it to spill. So when you go and make this move here, you shouldn't see the pelvic tilting, rolling, dipping on either side. If it's doing that, then there's a weakness in that plane of motion for you and we need to strengthen that up, okay? So let's do the other one. Back is nice and straight, nice and stable. She lifts the left leg, the right arm, and she looks straight ahead when she does that. Very good. Okay. Now this one, you're not going to be able to probably do as many of them right off the bat. Thank you, Lindsay. You'll want to gradually work your way up with these. So start with 5 or 6 of them at a time, then gradually work your way up to 8 to 10. And hold it for a little bit longer. First start with holds of about 2 to 3 seconds, and then you can gradually work those hold times up to 3 to 5 seconds. And that is a proper bird dog. Okay, this next move that we're going to do is called a push-up plus. Now this is a maneuver that we use to mobilize the thoracic spine, which is your mid-back. If you'll turn around, Lindsay, just a bit, I want to show them the area of the spine between the lower neck and the upper portion of the low back. So this area has a different curvature in it, okay? It's not the same curve that exists in the neck and that exists in the lower back. The curve here goes the opposite direction, which is frequently an area that gets bound up and really locked up on people, especially if they sit a lot during the day. So people are always, when they're stretching, they're always going back and extending their back. So this is an exercise to mobilize and make that area move without affecting everything else at the same time, okay? So Lindsay, if we'll go ahead and go in the position here for push-up plus. Very much the similar position that you would utilize for cat-camel or a bird dog. So the push-up plus, you're not actually doing a push-up, okay? And other people have different terms for this. This is just with a term that we use. You're basically going to be pushing up the mid-back and extending the mid-back, okay? So start by letting your mid-back sink. So what I'm feeling here is her shoulder blades coming together and squeezing my hand. This is just providing extension, okay? Now Lindsay, let's come the opposite way up. Notice it's very similar to that middle portion of a cat-camel. So she's arching the back up. Now let's go to extension. Extending the hand. Now let's arch it all the way up. But if you'll notice, she's not doing it here and in here. She's just isolating this middle spine, okay? So mid-back pain or stiffness between the shoulder blades, this is your go-to to help get flexion and extension back to the middle spine, okay? Do a couple more, extend. Squeezing my hand together and all the way up. Very good. So another thing that this is going to help with is when a patient does a push-up. A proper push-up, you should not see the shoulder blades winging out, okay? You should not see the shoulder blades coming together, squeezing your hand. So this is going to strengthen the area between the shoulder blades so that when she does a push-up, let's say you're in push-up position, Lindsay, but on your knees here. When she goes and does a push-up, her shoulder blades stay nice and stable against the rib cage and her back isn't sinking. So go up to arch it here. There we go. And now as you're like this, I want you to do a mild push-up, okay? Just a partial push-up. There we go. And then up. So if she does that and they're squeezing your hands, if her shoulder blades are squeezing your hands together, we know that we're losing stability in the shoulder blades against the rib cage. And scapulothoracic instability, which is what that's called, can be a big problem, resulting in a lot of shoulder pain. Okay, so you can utilize the push-up plus here for strengthening for push-ups and for mobilizing the middle spine. So it's kind of a 2-for-1 exercise, and that is a push-up plus. This next maneuver we're going to show you is called a side bridge. Now it's more of a strengthening exercise. It is a mobility exercise, but it's going to require you to already have some good mobility in the spine. So this will be something you work on towards the latter part of your strengthening program in your low back. So the purpose of a side bridge is to strengthen the different sides of the lower spine. Strengthen up the lateral side, so strengthen up the right and the left separately, okay? So Lindsay, if we'll go ahead and start demonstrating it on this side here first. The position you'll get in for this, and this is called a side bridge, so it's very much like a regular bridge except you're just on your side, okay? So you want your hip and torso at about a 120-degree angle, so we're going to bring the knees up just slightly. There we go. You want your knee at about a 90-degree angle, and you want to keep this foot directly on top of the foot below it, okay? Hand, you want it nice and straight along your thigh, and you want your head nice and neutral here. Your shoulder here, you want your elbow directly underneath your shoulder, okay? Now, if you have shoulder problems, and this is a difficult position to get in, we may have to make some alterations to how you do this, and we can, of course, evaluate you individually and see what you might need to change. But depending you don't have any shoulder issues and you can get in this position, you want your elbow right underneath your shoulder at a nice angle, just with no angle actually right here, okay? So the first component to a side bridge is going to be to lift the pelvis up. You will always be maintaining contact on your knee and on your elbow. So the only thing that lifts is everything between. So let's lift up. The second component is to bringing it out forward. So now you go all the way straight and lifting the head and keeping it nice and neutral with the body. And let's go straight back and down and relax. So the side that we're working on when we go through these maneuvers are, especially the side bridge here, is the side that's closest to the table, okay? So in this demonstration, we are actually contracting the right side of her lower spine, working on strengthening the right side. Of course, you can switch over and you can do this on the left. So let's just go ahead and switch and have your head down here. There we go. And we'll do it to the opposite side. Elbow right underneath your shoulder with no angle. There we go. You want your torso and your hip flexors about 120 degrees and about 90 degrees here, okay? So the first component is the lift, and then the second component is extension. As you extend, neck goes back neutral. You want to try to make a straight line from your knee to your chest. So there's no angle or bend in the hip flexors here. It's a nice straight plane, okay? And back and down. Now you'll have to start with very light on these. You'll have to start with just a few at a time. This is a great maneuver if you've ever seen someone who is what we call antalgic, or they've pulled a muscle in their back and they're kind of crooked, or they're walking off to the side where they got one side that's just in spasm and it almost like it pushes their pelvis over. This is a great maneuver to start doing with them to contract and relax and contract and relax the muscle, which will eventually shut it down, and it helps relieve a spasm. So in addition to treating pain, it's also a good stabilizer, so it will strengthen the spine as well. Okay, and that is a side bridge. The following exercises we just showed were those for the lower back. They're going to be great for addressing patients with acute pain, chronic pain, specific injuries, and those who just need more stabilization and more strength in their lower lumbar and their core muscles. Remember, if these exercises are causing any pain, be sure to stop them and ask your provider. Remember to use these exercises. They're most effective done twice a day, once in the morning and once in the evening. And if it gets too painful, obviously use some ice for about 15 minutes on the area with a towel, and then call your provider. We hope this helps.